Hi, I'm Tom Threlkeld, Director of Communications for the National Association for Home Care and Hospice. With me is Emilie Bartolucci. She's Director of Grassroots Advocacy here at NAHC. Emilie, there's no doubt the big story this year has been PDGM, the Patient-Driven Groupings Model. NAHC has led the way in education on this because it's a big change. This is going to revolutionize home health care payment in the 21st century. But a lot of people are very concerned about it. Tell us why.
So Tom, this new payment model contrasts greatly with the current version and places a huge burden on agencies. It's causing them to alter the very nature of their operations to comply with its standards. The biggest issue with the new model surrounds an applied behavioral adjustment in its implementation. CMS has used this authority to institute a proposed payment adjustment of 8.01% in the very first year of implementation. It's based solely on assumptions of provider behaviors they believe might occur, not actual behaviors. The reduction translates to almost $1.3 billion in reductions in home health care payments in 2020 alone. It's a staggering number, and one that, if implemented as proposed, would heavily impact the home health community at a time when the demand and need for its services is only growing.
So obviously this is a big problem for home health care, but we know that if there is a big problem in home health care, NAHC is working on a solution to it. What is that solution?
Tom, with the help of all of our members at NAHC, legislation known as the Home Health Payment Innovation Act has already been introduced into the House and Senate. It has bipartisan support, and if it's successfully passed into law, this legislation would still allow for the new PDGM model to meet all the requirements of the Bipartisan Budget Act, but it would bar CMS from making pre-change rate reductions solely based on assumptions. And if behavioral adjustments were made, they would need to be based on actual changes in behavior and allow for a phased-in approach of the adjustments. It gives providers time to appropriately adjust without impacting access to care for all of their patients and families.
So it sounds like we could use some support from the general public on this issue. What can they do?
It's a great question, Tom. So to get this legislation over the finish line, we need everyone's voices, hearts, and action. We want you to open your computer or smartphone and visit the NAHC Advocacy Center, click on the Home Health Payment Innovation Act, enter your name and address, and hit send to contact your legislators. It's that easy to show your support.
Well, you heard Emilie. Please go to the NAHC Advocacy Center and support the Home Health Payment Innovation Act. Millions of patients and providers, probably someone you know, are counting on your support. Thank you very much.